Welcome, everyone. Thank you for joining us. I'm so sorry, bear with me. Technical difficulties. Here we go. Thank you for joining us for How to Talk to Children About PKD. My name is Lauren Winchester, and I am the hospitality host for this session. If you have any questions during the presentation, please type them into the chat box, and we will address as many questions as possible during the Q&A session. We ask that you please keep your microphone muted throughout the session to ensure good audio quality for everyone. I am very pleased to introduce our speakers for this session. Dr. Kushal Mathia is a licensed attending psychologist for the Nephrology and Advanced Cardiac Therapies Services at Children's National Hospital. He's also an assistant professor at the George Washington School of Medicine and Health Sciences and affiliate faculty with the Child Health Advocacy Institute at CNH. His clinical interests include interventions to improve medical adherence, adjustment to diagnosis and treatment, and readiness for transition to adult care. He also provides services targeting emotional and behavioral difficulties and adaptive functioning problems. Dr. Mathia is passionate about advocacy and community outreach, particularly around mental health awareness and access. Also joining our panel are parents Jackie English and Heidi Cambereri. Dr. Mathia, panel, it is my pleasure to turn the presentation over to you.
Thank you everyone for joining, and thank you to the organizers of the event for inviting me to this event. And it's a pleasure of mine to be able to talk to some family members, some providers, and kind of this amazing group of people. So I'm going to be talking about my experiences with PKD, children with PKD, and chronic kidney disease in general, and chronic illnesses. But I fully understand that you guys are the expert on this. Kind of you live with it. You like if it's ADPKD, some of you probably had kind of went through the same process. You have kids who have PKD, so you are living it, right? So I'll have like some tips here and there, but what I would love to do is to hear from you guys. And I would love some tips myself on how I should, I can work with our patients better. But also, if there are specific questions that you guys have, I would love to answer those, right? If I'm able to, I'll try my best. So we have the activity disclaimer. I'm going to have this up for you guys to read for a little bit. And disclosure. And to add to this, I have no relevant financial relationships to disclose. Okay. So the introduction is already done. So I did want to kind of go over a little bit more about like who I am and why I'm talking to you guys. So I'm the attending psychologist with the Heart and Kidney Services at Children's National Hospital in Washington, D.C. So throughout my grad school training and my residency and fellowship, and now as a fourth year faculty, going into my fifth year soon. So I've had the opportunity to work with a lot of patients and families from all different backgrounds of chronic illnesses. But especially right now, I primarily work with chronic kidney disease, including PKD. And I work with, as a psychologist, one might think, typical psychology work is kind of working with depression, anxiety, behavioral issues, ADHD. However, as a pediatric psychologist, my role is quite different from, or more than that, more than a typical psychologist or therapist. I work with patients and families around adjustment to diagnosis and treatment, around preparing for the diagnosis, preparing for surgeries, treatments, pain management, addressing issues with effects of the medications, some of the symptoms of the disease themselves. And I work a lot with adherence, so helping our patients and families do the best they can with the treatments that they're being told to do, right? So the nephrologists. Hopefully, you have great nephrologists who talk to you guys, and give you some great recommendations and work through it. But kind of my role comes in when kind of maybe the families or the teens in particular are having issues with dealing with their disease or feeling very different. And I'll go through these things in a little bit, but kind of what we can do to help them understand their disease and make a commitment to doing the best they can. And as an affiliate faculty, I do a lot of advocacy role, and I wanted to kind of bring that up because a huge part of advocacy that I do is working with the patients and families around health literacy, making sure that all of patients, regardless of their background, their education level, kind of we're doing the best we can, and kind of understanding cultural diversity and the inequity issues that kind of we are very much becoming more and more aware of right now. They do a lot of that, and as I mentioned, I'm an assistant professor of pediatrics. So I train a lot of students and residents and fellows as well. Right. So mental health problems in children with chronic illness it's pretty high compared to the general population. So when you look at, can compare children with chronic illness, including PKD, of course, and look at the general population, we see higher prevalence. But I want to start off talk by saying that majority of children and families actually do very well, right? So even if there is a higher prevalence compared to the general population, the overall, majority of the kids are gonna adjust well. They're gonna be fine with medications. They're not gonna have as much anxiety. There may be a little here and there, but what we see is that in general, a lot of the issues that we see are, kind of coming up here and there are very normal, right? Like kind of parts of growing up, right? And they just have this additional thing that they worry about, not necessarily diagnosable or maybe even needing treatment. Okay. But in a good amount of population, though, we do see that there's depression, anxiety, behavioral problems. Other things to keep in mind: executive functioning, which is attention, memory, organizing, right? So when there's a task in front of you, how do you do it? How do you remember what to do? Are you paying enough attention to do it? Let's say when you're doing homework. So that's an important part to kind of keep in mind that this does happen. Difficulties with learning and academic functioning we see delays in adaptive behaviors, meaning brushing your teeth and getting ready and kind of being able to cook for yourself and go from one place to the other. We do see that in children with chronic illness, there's a little bit of a delay, and it could be because of the difficulties with executive functioning and learning. But it also could be kind of a learned behavior where they are in the hospital for such a long time, or they go in and out, or kind of families are very protective of their kids, so they do a lot of things. The parents do a lot of things themselves, so as to not kind of have the kids be in pain or kind of have to do more than they already do with taking medications and such. So then they're kind of somewhat delayed, perhaps. And because of all these things, we do see some issues with quality of life. All right, so kind of the way I wanted to do this is kind of have it like a Q&A or kind of frequently asked questions. So these are the questions that I typically get from parents on how do I talk to, how do I help my kids adjust to having a diagnosis and treatment, right? So these are the questions I'm going to go through one at a time. So first one, is there a right time to talk to our children about a diagnosis? There is no right or wrong time to talk to children about their health in general. I'm just going to put it out there, okay? Especially when there's a diagnosis or there are treatments happening. You shouldn't wait for the right time, right? Like maybe something happens, right? Like the kids have PKD or they've been tested perhaps, and that they are going to develop, or there's a concern about developing PKD because of genetics. Don't wait until they have a symptom or they're in the hospital or they kind of they are with the doctor to have this conversation. You can have this conversation, kind of and we'll talk about, how you might step into it, not just like randomly at dinner table, be like, hey, there are ways to do it.
5-minute warning.
I'm sorry?
5-minute warning.
Okay, all right. Oh, really? Well, we might have to like switch around a little bit the first. Okay. I'll keep going. These topics are not to be discussed once, right? Like just we want to have the discussion not over and over, so kind of like an ongoing basis. So it's kind of like an open-ended thing, not like, okay, we talked about it, we're done, because the kids might have more questions, right? Or you might have more information to give, so it should be very dynamic. Right? At what age should parents start the discussion? So children, what we know is that children become very much aware of the differences between them, their siblings, their kind of peers in the schools at a pretty early age. So they might pick up on the fact, maybe not when they're 4 or 5, but that, kind of they do pick up on the fact that the other kids may be, healthier, or they don't get tired as much, or they don't complain about pain as much. Or, if because of some symptoms or treatment, they are not able to go to a sleepover, right? So they understand that all of my friends were able to hang out, like why am I not, right? So they might already have these curiosity and questions that they start seeing that kind of like, I'm a little different from other kids. So it's important to kind of address that early on. And of course, kind of it should be developmentally appropriate language, right? So use the language that you already use for, when you have a fever perhaps, right? Like have an owie, or when you don't feel, if you feel crummy. So kind of language should be developmentally appropriate, not necessarily age appropriate, but developmentally appropriate. As you mentioned, kind of there might be developmental delays perhaps. So you want to know where they are. Ask questions themselves, but don't wait for them to ask the questions to initiate the conversation. It's always a good idea to start early on. To actually start the conversation, the first thing I always tell parents is self-care is such an important part. And especially because, kind of, again, especially with ADPKD, you might have already gone through these symptoms and treatment yourself, right? And now you're seeing it in your children. So there might be this added layer of, kind of maybe not anxious, right? Because you're used to it, you know what's going to happen, so you might not be anxious. But or on the other hand, you might be very anxious. I don't know how it's going to go. How do I feel about it? So what I always recommend is take a step back and manage your own anxieties and frustrations. Managing does not mean having to let go or forgetting or just being completely okay with it, right? You don't need to go to be in therapy or take, kind of Lexapro for, kind of several months to start this conversation, right? If you need to, of course, that's very helpful, of course. I always recommend therapy and treatments, medications for everyone as needed. But it doesn't have to be that. Just, at the moment, just, kind of make sure that you need to stay calm. Well, actually, that's not true. Let me take that back. You might get upset, and that's okay. And that's a good way to model that. That's actually in the next slide, but I'm jumping a little ahead of myself. So label your feelings and express them in an adaptive way so your child can kind of model after it. Let them know that you don't have all the answers and that you're educating yourself too, especially if the PKD diagnosis is new to you, right? So you might be very anxious, so doesn't mean that you have to, when you sit down with your child, no matter what age they are, that you have to have all the answers, right? And letting them know that you don't have, and sharing your experiences with them can be very helpful. But most importantly, ask them about their experiences. How does that make them feel so far? Like, does it bother them? Like, do you think, kind of it's okay? Or kind of, actually, we'll get to that one a little bit too. Validate their experiences, right? So again, especially with parents who had PKD, you might have your experience be the experiences that you had might have been very different from your kids. So if they are afraid and you are not, rather than being like, oh no, I wasn't afraid, like you don't need to be afraid. I would recommend validating the experience, even if they say, they're mad, they're angry, they're sad. It's kind of like, oh, I see that, right? And I can see how that would happen. Right? But let's try to think about it in a more adaptive way. For the teenagers, kind of changing perspective, changing their thinking pattern, any kind of mistakes they might have in their thinking that, oh, this is going to be terrible forever, right? Or these medications taste horrible and I'm going to have to take it all the rest of my life. They might have to, but kind of maybe it's not as terrible as they think, right? So there are ways to kind of work with that. But validate their experience. Yeah, like this is like the medicine is yucky, but like it doesn't really, you could take it and you drink a little bit of juice and you're done, right? Like so kind of you think it'll be okay, like after you take the medicine for like 5 seconds, and they might be like, okay, yeah. That's a big shift in kind of addressing their anxiety or why they're upset, because they might have the thought that this is the taste is forever there. Like, yeah, it's bad. So you're validating that, but then you're kind of pointing them in a more adaptive way of thinking. Yeah. Are there different ways to talk to kids about based on their age? Absolutely. Children in different age groups of developmental level need different ways of discussion. Again, use languages that are more appropriate for their age and that are already in their vocabulary. But of course, add more terms to their vocabulary that they can understand, right? Or help them understand it. A great place to start, I always find, are books. And a lot of times it doesn't have to be kind of specific to PKD. And there are very few, actually try to look them up. I mean, there's definitely some books on CKD, but not necessarily on PKD. So it doesn't have to be a specific type of like just disease or disorder. Find a book, and there are plenty out there about, kind of, and there are different like age level and all that too, but like a child maybe who has a health condition, and kind of reading a book with them as an introduction, right, to like having a healthcare issue or healthcare needs, and the child might go through, and ideally these stories would have like more of like a maybe not a happy ending, but kind of like I'm going to be okay, kind of like a positive attitude at the end, right? So kind of helping them see that and identify with that character can be very helpful. And there are kind of TV shows that have I think more and more TV shows are now having kind of different healthcare difficulties, including mental health care. So I think it's a very good way to help them understand that, one, they're not this alone, right? And that there are ways, different ways of kind of being with having a disease. And of course, this is the most important part. Share your own stories and experiences when you were their age. And even if you did not have PKD at that age, maybe there was kind of something else that was happening, right? Like a difficult situation. You don't have to go into detail, of course, but kind of like, yeah, I was, when I was your age, like I had a hard time in school, or like I would get sick all the time, and then this is how I would deal with it. Right? So helping them again see that they're not alone in this. With older teens and on children, talk to them about their experiences they've had so far, and engage them in a way that they find like they're a part of the treatment and they're in control, not just a discussion of the treatment itself. Right? The options that the kids are let's go with the bad tasting medication, right? Maybe it comes in a pill form and you don't have to take it in a liquid, right? Or there are ways that you can kind of, or there's another type of medication maybe available. So having them have some connection and some control can be very helpful. Right? Other signs parents should look for in children who may be struggling with their diagnosis, of course, I get this question very often. It really depends on the age of the child. The main signs, I would say, if you're concerned about, kind of how are they doing, are they adjusting well, is if you see any changes in mood, sleep, appetite, energy, and this is beyond the disease symptoms and the medication side effects, right? Because a lot of times these side effects and the symptoms of the diseases can mask or mimic symptoms of depression, right? So if you feel like this is more than what would be normal with the diagnosis, talk to your pediatrician, talk to your nephrologist. There might be resources available. Okay? Another hallmark of depression, if that's what you're worried about, is lack of interest in activities. Right? So even if they're able to, kind of they have the energy and they don't have the pain, and they usually love playing basketball, but they just kind of, don't want to, there might be an indication that there may be something going on. Right? Irritability is another one, which again kind of gets very dicey, especially with like preteens and teens. But also being more clingy and always needing to be with parents, that's another symptom as well. So younger children may also kind of do this and kind of play when they're playing, when they're drawing. So I would always recommend trying to be more proactive and than reactive in having discussions and addressing difficulties. Okay, so I think those are my slides, but we definitely want to hear from about some patient experiences. So we have Heidi Camberberry.
All right, hi. Hope everybody can hear me okay. Thanks for having me. And that was great hearing all those tips, because it's making me feel a little bit better about how I approach talking about PKD with my own kids. So thank you. I'll give you a little bit of my own history first, just so you can better understand my perspective as I was going into talking to my own children about PKD. Honestly, I can't remember a time when I didn't know about polycystic kidney disease, but I guess my first real awareness of it is probably when I was a teenager, that I can, really remember, because my father had to drastically reduce his intake of meats and peanut butter, his two favorite foods in the world, because his kidney function had started to decline. So that's kind of when it became a regular part of our own family conversations. It was only a couple years after that I had my own diagnosis. At age 19, I had a kidney infection that had stemmed from an untreated UTI, which I'd had some symptoms, but didn't know what they were, didn't say anything. They went away, but the infection did not. And so I had a kidney infection. So made a point there to make sure that I told my own kids symptoms that they need to look out for so they'd know right away. But after that infection, my dad talked to his nephrologist. They decided I needed to get tested. Lo and behold, I had PKD. I was upset when I got my diagnosis, but I wasn't devastated. I think because my own parents my dad had just sort of been so matter of fact and positive about living himself with the disease. Shortly after that, he had dialysis. He had a transplant. I had a more severe kidney infection, this time one that had started in my cysts. So PKD definitely got more real at that point and had a much bigger impact on me. Also, it's just as you get older, you feel a little less invincible. So then fast forward to when I had my own kids. So I have two daughters. They are now 17 and 19. And they have not been tested yet, but I'll come back to that a little bit later. But my girls really grew up with PKD as part of their vocabulary. I became heavily involved with the PKD Foundation right after my second daughter was born. So my oldest was only 2 at that time. We started a local PKD Foundation chapter in the Hudson Valley, and a walk for PKD. So from the time they were toddlers, they were going to the walk for PKD. So I think early in their life, they were hearing about it, but they were associating PKD with this t-shirts and balloons and face painting and a fun day with their cousins and their aunts and uncles and their grandparents and friends. So it kind of had this positive vibe for them at first. They knew PKD was this thing, but they didn't, they associated it as something very family oriented, which for us, it really is. As they got older, I made sure that they learned a little bit more each year. And I found actually that walk, that social and family piece of it, gave me a great segue into having the conversations, because it wasn't really outwardly affecting my life personally at that point, but I knew that it would at some point, and it could for them also. So when they were starting probably around 5 or so, started kind of asking questions, so do you know why we go to the walk for PKD? I might ask them, and then that would kind of segue into, usually they're like, what? I don't know. And so it would segue into, well, this is what PKD is, and these are what your kidneys are, and some of those just basic conversations. And usually they would kind of ask some of their own questions then. If they didn't, each year I'd challenge it a little bit more with other questions. They'd always ask the hard ones in the car. But they'd ask things like, does somebody in our family have PKD? And I was like, oh yeah, your papa does. I kind of started off with their grandfather. And then gradually, as they asked more questions, I was like, oh, well, it runs in families. So actually, your aunt has it also. And then they're like, Mom, do you have PKD? And I was like, oh, yes, actually I do. And then, do I have PKD? And we could have that conversation about the fact that you might, we don't know yet. And we kind of handled a lot of questions that way. And as they got older, the questions would get more technical, what they wanted to know or what I felt they needed to know. So I guess all along, our approach has very much been direct and honest. And it's just a matter of fact and a part of our lives. From personal experience, what I could share with them so that they wouldn't be as nervous about it is some of my whys, so this is why, what I'm doing to take care of myself. I'm trying to keep my body healthy because that helps my kidneys to do their jobs more easily. Let them know, oh, my ribs really hurt today. And you know what? That's because I have a big cyst right there. And the exercises I did yesterday were aggravating that, I think. So they know, and what I'm going to do, okay, I have to rest a little bit and it'll feel better. Being honest about the fact, yes, I know we're on a road trip. I have to stop and I have to pee again because I'm taking a medicine that makes me drink a lot of water, but the medication's not that bad. Stopping an extra time isn't too bad because it's going to help keep my kidneys healthy longer. So, it's worth the trade-off. So I'm trying to keep each thing as it goes positive and manageable when I talk to them about it. And then for themselves, and also saying, that empowerment piece of, this is what I'm doing. So, I'm having a fundraiser or I'm going to a meeting to learn more about PKD or to raise money so that doctors and researchers can have more treatments. And, I can tell them, well, when I was a kid, I had asthma and I used to get really, really sick and I'd miss school and I'd have to go to the hospital and there wasn't much they could do. And now you guys have asthma and you just use an inhaler and you've been totally fine. So I'm hoping that anything, I watched what my dad had with PKD and you've seen your grandfather and said, for me, I still, I have some things that happen that don't always feel great, but I'm hoping that all this research will lead to treatments so that as you guys grow up, you're not going to have to deal with, you're not going to feel the same way, that you're going to feel even better and have more that you can do. Now that they're teens, we really have a lot of conversations about, they really know everything sort of. It's our dinner table conversations the day I go to the nephrologist will be the whole update, what I learned that's new, where I'm at, what's coming up. We've been starting to talk about when they'll get tested and the pros and cons for that. In talking with their doctors and my doctors, they know that as long as that their doctor's checking out, that they get their blood pressure checked every physical and that they have to do lab work, even though sometimes their pediatrician will be like, oh, you had labs last year, they were fine, you don't need them this year. And they know that I'm always like, no, my nephrologist says you need to get your labs every year to check and make sure your kidney is okay. So we have that conversation about their own health. And now as teens, again, giving them some of that empowerment of, you don't know yet if you have PKD, but here's some things that you can be doing to keep your kidneys healthy no matter what. And that if you do have it, if you keep getting your exercise, if you make sure you're drinking plenty of water, if you're eating mostly natural foods and trying to stay away from things that are packaged, some of those lifestyle things that can just be good habits for them. They're curious. My 19-year-old, I think, is pretty close to deciding that she wants to get tested and find out. And again, those are conversations we're having with her doctor and with her. And, they're at that point, but that's sort of, how we've handled it all along. And I guess I'll stop there, give Jackie some time, and happy to answer questions later.
Okay, that sounds good. I'm Jackie English, and I am located in Wisconsin. I am the Milwaukee chapter and walk coordinator. And my kind of journey to PKD was a little different in that I did not know that my mom had PKD until she had a transplant. And I did not know that it was genetic until I used to work in nonprofit, and I had the PKD Foundation approached me about a donation, like a local chapter approached me about a donation. And I was chatting with her about how my mom had it. And that is how I found out it was genetic. So my mom did not talk to me about it at all. So when I was in my 20s, that's how I kind of found out it was genetic. And then I was diagnosed actually shortly thereafter. I just had really high blood pressure at just a regular appointment. But it became very important to me then in my 20s to really engage with PKD, engage with the foundation, find out and learn everything I could about it. I wanted to be very active in my experience with this disease. And that's really been sort of my lifestyle with it all along. My mom unfortunately passed away before I had my children. So they know that our Mimi isn't with us anymore. And they know that that's why, that something was wrong with her kidneys. My kids are very little, they're 4 and 5. And I was very active with the PKD Foundation when they were born. So they definitely have like come to chapter meetings with me since they were very tiny too, and were toddling around and knew lots of people at various points in our PKD journey. And the walk is really also where they mostly engage right now with PKD and with the understanding of PKD, that we do it every year, that it's fun, and as the walk coordinator, it becomes sort of a very long experience of, you know, gathering raffle items in the house and getting all the signs and doing all this and all the prep work for it. And they kind of come along for all that. And that's been a really good positive place to start with their experience with PKD, that it is, you know, that there's this big community around it, that this is something we're all battling together. Because even as a patient, it can sometimes feel like, you know, you're meeting with your nephrologist, or you're meeting even with your small chapter. We forget like how big of a community we all are, and how many people, you know, are living with and battling against this disease. So I think that can be really empowering. Because my kids are so little, a lot of the time when they have questions about PKD, I try to remember what are they really asking me, and what do they want to know, you know, from their perspective. So they'll ask, you know, they ask about death because, like I said, my mom, you know, passed away and, you know, she's not with us. So they'll ask, you know, Mommy, are you going to die? And I say, you know, yep, everybody dies at some point, not today. So, you know, not right now. So it's not anything we need to worry about, because what they're really asking me is reassurance. I think what they're really asking me is reassurance that this is not something we need to be, you know, afraid of right now. So I try to keep in mind where are they coming from? You know, what are they really asking me? And much of our experience with PKD right now is me trying to lay the foundation for them of like Heidi said, too, being very direct about it. This is part of my life. This is part of who I am and part of my experience with the world. Everybody's got stuff. This is some of my stuff. And I try to set the tone now as an example of how to live with PKD. What does it look like for somebody who has PKD? How do you live with it? What does it look like as part of my life? So when they are older, you know, they've seen me live with it for many, many years. So when it starts to become more of our daily life, you know, when I'm looking at closer to transplant, things like that, this has been something that's been all along and has been consistent and, you know, openly discussed. It's not anything that I keep secret. It's not anything I feel like we need to be secretive or have any of that kind of emotion around. This is something that's just, you know, part of who I am. So I try to model for them what it looks like to have it be part of my life, what it looks like to be active and informed in my experience with PKD. And right now I just try to kind of limit, we talk really briefly about kidneys or something and then move on. We've talked about, you know, mom takes medication. They've seen me take pills for it. Move on. You know, I just give them the information they're looking for at the time and then kind of move on because they are still very little. And I know we had spoken earlier too about how I think the PKD landscape is changing so fast and it's so positive and there's so many amazing things happening. I think this is going to continue to evolve and be a very different world for them. So we cover what they need to know now and you know, keep it positive. And I just try to think day to day of living my life the way I want to and modeling it for my children. So that's where I'm at.
Let's see if we don't have any questions or while we wait, is there anything that the panelists didn't get a chance to share that they would like to go ahead and share now?
It's more of a question for my fellow panelists. I did want to ask Jack and for first, when you're talking about one of the things that I work with, as I mentioned, with parents, is kind of working with their anxiety, right? So, given that you've had experiences with PKD yourself, what's your approach in talking to the children? Like, what are you concerned about that they might be concerned about? If that makes sense. Do you feel like they have anything and like a question that you might not be able to answer, or that you don't feel like you're confident in answering?
I mean, I think personally, if I'm being like super honest and present, I'm afraid that because, like, for me personally, where am I at with it? I sometimes fear, like, my darkness about it is, how will they feel about me because these genes came from me? How will they feel about me? And my husband and I had a lot of discussion about this when we were talking about having kids, and about how, I've lived a really great life. I mean, up until now, I have lots in front of me too, but I've had this really rich life where I've had this opportunity to do so many things, and PKD has not prevented that. So while it's part of this, this mix, it was not something that limited my ability to have a wonderful, amazing, exciting experience in life. And I hope to sort of give them that perspective on it. But like, if I'm honest about like my fears as a parent and talking to my children about it, that's my fear, is how will they feel about me because it is from my genes.
That's good. It's funny listening to you talk about it. It's so similar to how I view a lot of it, and the same things that I say. The same thing when we were having the conversation about whether or not to have kids, because my dad didn't find out until after myself and my brother were born that he had PKD, and their doctor thought they were absolutely absurd to have my sister, who did end up having PKD also, going into it. And my sister and I like, well, we're happy to have been here. But I also appreciate the fact that everybody's PKD experience isn't the same as ours have been. My dad's, and my family so far, it's been pretty good. Everybody seems to hit a point of kidney failure somewhere between 48 and 60. But overall, the quality of life issues haven't been impacted too much. And I know it's not the same for everybody. So I think one of my biggest fears is the trajectory of it, or the path being different for my kids. And also, the burden as I do get to that point. Having gone through it with my father, dialysis and kidney transplant, it's a big deal, and it has a big impact on the whole family. So what impact that will have on them when the time comes. And we haven't really talked about that too much yet, but that's one of those things that weighs. But now with older teenagers, these are the kinds of conversations that we are starting to get into now that we didn't have to have when they were really little.
Exactly that. Exactly that, Heidi. Yes. Same.
Looks like
About 5 minutes left.
Looks like there's questions.
Yes, we did get a couple of questions. At what age should we order labs my children to monitor their kidneys?
We have not started yet. But my children's pediatrician also has really looked to me to kind of be the person who's like, what do we do about PKD? She doesn't, my children's immediate pediatrician does not have a lot of experience with PKD. She's really asked me a lot about it. So I get a lot of advice from my nephrologist about like what should I be looking for them, and how can I share that with my kids' pediatrician. So I don't know.
Mm-hmm. Yeah, if I recall, I think my kids were probably around 5, probably around the time they were entering school, that their pediatric office just routinely started doing basic lab work. And I think the philosophy on labs and kids has changed over time too, and not every office is the same. So, but my nephrologist kind of supported that notion of a kidney function test, like if they were getting blood work, to make sure they test the kidney function, that they do a urine test, and that they get their blood pressure checked every year. Those were the big things. And like I said, my pediatrician, their pediatrician's office now only suggests labs for kids every other year, but my nephrologist has suggested highly that they do it every year. So we do. That could vary.
Sorry, and then a second question, how have you explained transplant to young children?
My littles, like we've talked a little bit about it in that we talked about how my mom received a transplant from her sister and was with us for an extra 10 years. So they know that we do a lot of celebrating that around Donate Life Month, et cetera. We do a lot of celebrating around my aunt and that gift that she gave my mom. So we talk about it in that respect. And they know I'll need something someday like a transplant, but we just talk about it as like, it will help fix my broken kidneys.
Yeah, with mine, it was probably, I guess the earliest conversations were same thing about my father, their papa. And, you know, one of the times when they were asking about who had PKD in the family and just saying he had it and he had to get, you know, at first it was just sort of like, well, he had to get a new kidney, you know, and we didn't really talk about where that kidney came from and they didn't ask. And it was older. It's been more when they were probably like middle school age, my aunt had a kidney transplant. So at that point, we talked more about the specific details of when somebody needs a kidney and how do you get a kidney and what does that mean? So, you know, we talked about she's looking for a donor. If there's a family member that's able to, you know, you have 2 kidneys, so somebody can give that's healthy can give one to somebody else. But the trouble that she was having with finding somebody that could give her a kidney, and that sometimes if somebody dies from some other reason, something horrible can happen, somebody passes away, but that their organs, their kidneys and their heart and their lungs can sometimes help other people who are sick to get better. So a little piece of them gets to keep living. And so we talked about that. And that's what happened. You know, now they know that my father, 25 years ago, somebody that died from something else horrible, their family decided to give the kidney to my father. And so he was able to live and see them and, you know, and watch them grow up. So we've kind of talked about it that way, but we didn't get into details of where the kidneys came from until they were a little older.
And what I find helpful is kind of talking to especially with like very young children, kind of talking about their body as, you know, like here, there's like a toy or like a machine, right? Like a part is like maybe not functioning well, right? Like it's not working. So what do we do when we have like a part that's not working? We'll take it out and we'll put another one in and kind of work, continues to work, right? So kind of like, again, kind of using the language that they understand and kind of, oh, okay, it's kind of like my body is a machine and keeps going and you just release it. That can be very helpful too.
We do have one more question and one more minute, so hopefully we can get through it. As Heidi and Jackie are both publicly sharing that they have PKD, did you have any hesitations about going public with your diagnosis due to the impact of that publicity on your children?
I didn't so much when they were little, because I was same as Jackie. I was really involved in the Kidney Foundation when my kids were really little. As they got into upper elementary school and middle school, I backed off a lot on how public I was about my diagnosis, because I had had articles in the local newspaper and things, and I wanted to give them their privacy in how much they wanted other families to know about, you know, their friends to know about medical things in our family. Now they're fine with it. They're like, go ahead, mom, whatever you want. And I can ask them. Middle school, I kind of gave them that space and backed off a little.
Yeah, we're very active with it. And it's definitely just a part of our family as much as, you know, anything else. I'm really active too with like health advocacy stuff. So they are definitely involved in a lot of that with us. But I have not been as hesitant about it in that it has publicity, but it's, you know, it's part of who we are and it's part of, you know, our family and as much as it would be if it was like, you know, a cancer diagnosis or, you know, anything else that we had going on, if we were looking to adopt, if we were looking for, you know, any of that kind of stuff, we just kind of, culturally in our family, that's who we are, that we just sort of share it and you know, embrace it. So.
All right. Thank you, panelists, so much. And thank you, everyone who attended and asked those great questions.